All right, it's no secret that China has complete control over its media. Using the state media machinery, Beijing is trying to influence the global narrative. But some courageous citizen journalists have managed to get the truth out. Chen Qiushi and Fang began recording clips and started sharing their story of China's failing response in a bid to try and contain the outbreak. But what's happened to them is this: they've now gone missing. And WION has managed to access their reports, and this is the story that they were trying to tell about what is happening inside China right now.
Chen Qiushi and Fang are two men who dared to challenge the Chinese state. Both of them are citizen journalists. They were reporting about China's struggles to combat the coronavirus outbreak. Even at a time when Beijing is grappling with a health emergency, it continues to silence dissent. After their critical reportage, both Chen Qiushi and Fang have gone missing. Reports say they have been arrested. Chen Qiushi was perhaps among the first journalists to document life inside Wuhan. The 34-year-old lawyer turned video blogger defied press censorship in China. He managed to sneak inside the Wuhan Central Hospital. This is what he found.
我去跟那个护士聊了一会儿，我说你们这儿病人这么多，你们工作压力很大呀。护士说这算啥呀？这已经少多了。你没看前几天，整个走廊堵满了，挤都挤不动，得有上千人。那时候我们紧张啊，我们那个压力那个大，那2天天天哭，天天哭，都没见过这个，太吓人了。那现在已经好多了。
陈秋实律师被失踪了。
Fang was the other voice of dissent. According to social media accounts, Fang was arrested on Monday. Reportedly, he was trying to post another video at the time of his arrest. Reporting out of Wuhan, Fang shot a viral video of bodies piling up inside a hospital.
刚才3个，现在我数一下啊，4袋，1、2、3、4、5、6、7、8，有8个。哎呦！ 这么多，真的死了。这是几天？就昨天是吧？哎呦，这死人这么多啊！这是病房帮我进的，他在往这搬尸体呢，往这搬尸体。
All right, so this is what, of course, is playing out within China at this point of time. And to add more perspective on what is happening there, we're joined in by our correspondent Bruce Harrison, who's joining us live from Hong Kong. Now, good afternoon to you, Bruce. We've just seen the recent death toll in the last 24 hours. And what we've witnessed is that there is the highest spike that's been so far in the number of infections that have been recorded and also in the death toll. How is all of this being accounted for?
Well, that's right. We've seen a spike in the number of deaths in the past 24 hours, as well as confirmed cases of the viruses. What officials are reporting, what media are reporting now, based on reports from Wuhan and Hubei provinces, this is because they've changed testing methods of how they try and confirm that someone has the coronavirus. Previously, they were using diagnostic kits, but there was an incredible shortage of those, and a lot of people who needed treatment or to be confirmed for the virus to seek proper treatment weren't getting it. They're now using CT scans, and it's really boosted the rate of confirmed cases of the virus. This is a good thing for medical transparency. It's also concerning is whether or not officials did enough up front, and it may build more distrust in the government that they're having this change in numbers so rapidly right now.
Right now, Bruce, what is interesting is that, the fact that the number of cases of infection, confirmed infection, could have gone up because there is a changed methodology in terms of how the officials there are confirming the infections. But what explains the death toll that has gone up? 242 people having been killed because of this infection in the last 24 hours.
it could come down to a simple expansion in the reporting process. The government is taking stronger efforts to find these sick people, and it's not only raising the confirmation rate of those with the virus, but as well as those who have died. We've seen in the last 24 hours, in the past several days, that Beijing has replaced many top officials in Hubei province with other regional party loyalists.
Right.
And this could be a sign that not enough was going on, and maybe those numbers are reflective of these changes. The new people on the ground are turning things around. They're trying to show that Beijing has controlled the situation, and we're seeing a jump in the numbers.
Right, and also, can you give us a sense of what the situation is like, for instance, in the Hubei province, in terms of how people are able to access rations and medicines there, because the situation there is extremely dire?
From what we can tell right now, overall there's a shortage of everything. It's not just the diagnostic testing supplies. Even though they're using CT scans now as well to test for the disease, those are running out apparently, according to some media reports. Staffing has been an issue. A number of doctors have died from this illness as well. And masks, you can see mine is falling off, are also in short supply in Hubei province. Ultimately, this may be part of the reason, like I said, we're seeing Beijing change leadership in this part of China. And maybe those individuals will be able to turn this around and reverse the tide on the shortage of medical supplies. It's not just Hubei province, though. I mean, there are countries in Southeast Asia that simply have the inability to test for this virus, and they're exporting samples. So there are some that are even worse off than the medical supply situation in Hubei, though we know that's the epicenter, and more people obviously contracting the virus there.
All right, we'll have to leave it there. Thank you very much indeed, Bruce Harrison, for joining us and getting us all those insights in terms of what is happening right now in China. And do stay safe and do wear your mask there.